This is a presentation about the Comfort 15 Mini Scleral from number 7 contact lenses. We have to ask ourselves a series of questions with regards to the Comfort 15. What we need to do is define what is the Comfort 15, why should we fit this lens, who is the Comfort 15 for, and most importantly, how do we fit the Comfort 15? So we'll discuss these questions over the next few slides. Over the last 5 to 10 years, there's been a massive resurgence in scleral lens popularity, and this is due to several reasons. We have a vastly increased knowledge about the shape of the eye, thanks to instruments such as the Pentacam and the OCT. This has enabled us to design much better lenses. We have better manufacturing methods. The lathes that we use at Hastings produce very accurate, reproducible lenses. The fitting process has now become much simpler. Previously, scleral lenses were fitted with a moulding technique, which was tricky for the practitioner, uncomfortable for the patient, and didn't necessarily give us great reproducibility. So, why are we as practitioners fitting more sclerals? They generally give fantastic vision. From a patient's point of view, they're phenomenally comfortable. And there's no need to fit the irregular corneal shape, because there is no area of touch with these lenses other than on the sclera. So there are lots of mini sclerals available currently. On the whole, they tend to be between 16 and 18 millimeters in diameter. This can create handling challenges for both patient and practitioner. These larger designs also tend to be more complex, with a wide variety of parameters which can be adjusted. This increases complexity and also increases the cost of the lenses to manufacture. So the design remit for the Comfort 15 was to have a 15mm diameter mini scleral lens with a very simple fitting approach and minimal parameters that we can actually adjust. So this gives us a low cost, simple design and a very viable alternative to some of these more complex, expensive designs that are currently available. So let's think about our patients and who essentially the Comfort 15 is for. So our irregular cornea patients, so keratoconics particularly, patients with pellucid marginal degeneration, post-graft patients, post-LASIK and other types of refractive surgery, and those patients with post-refractive surgery ectasia are all highly suitable for Comfort 15 fitting. RGP patients who are essentially looking for better comfort than a standard RGP. So it may be that this RGP is the best lens for them in terms of vision and ocular health, but they're finding it almost intolerable to wear the lens consistently for any period of time. Soft lens patients who find the lenses are just not giving them really the vision that they need, they're uncomfortable, they dry out. Comfort 15 is an ideal replacement for these lenses. Our patients with dry eye and mild to moderate ocular surface disease, so Jurgen's patients particularly, will really benefit from having a Comfort 15 lens. Because this lens is fluid filled, the corneal surface is constantly in contact with fluid, no dryness occurs. Our high astigmats, so these patients that have got 6, 7, 8 diopters of corneal astigmatism, really the only option for them is an RGP. The lens tends and can be quite unstable. Comfort 15 will give them the vision that they require and the stability that they need to be able to function properly. And also our patients that may have ectasia, have a need to wear lenses, but work in very dusty or dry environments. As we know, patients that wear RGPs in a dusty environment, say a building site for example, will struggle with these lenses because of the dust getting underneath the lenses and causing significant irritation. The Comfort 15, which is fluid filled and sealed onto the sclera, doesn't allow any foreign objects to disappear underneath the lens and cause irritation. So an ideal solution for these patients. From a practitioner point of view, if you're interested in fitting patients with irregular cornea but concerned about fitting strategies with the smaller diameter RGP lenses, a Comfort D is an ideal lens to start with. It's very simple to fit and you're not having to concern yourself with the irregularity of the corneal shape. If you're currently fitting irregular cornea with standard RGPs and are interested in fitting scleral lenses, the simple fitting strategy of the Comfort 15 is an ideal starting point. Similarly, if you have some patients already in mini-sclerals and you're finding the cost is prohibitive either to the patient or to the practice or hospital, then the price of the Comfort 15 makes it very attractive as an alternative to these more expensive complex designs. And we do have some patients that are wearing these existing lenses that are struggling with the handling, so they're finding the insertion particularly difficult or the removal. And this could be patient or practitioner.